Immediate dentures is a type of denture that when someone is needing their very, very first denture and they need to have their teeth removed because their teeth are in such terrible condition. When we do the surgery, we would like them to walk out with a brand new set of teeth. So these are a set of dentures that we've custom made for them ahead of time so that when we do the surgery, we can immediately put the denture in their mouth. We like to call it a healing denture. It's an immediately goes in, but it's really a healing denture, and it really helps the healing of the tissues and acts as a mold for the healing of the tissues. And the patient will wear that immediate denture for approximately 4 months. They wear it for 4 months, but after 3 months, most of the healing is completed, and we take the last few weeks to make their final set of dentures. There's no one set fee for anything in dentistry, or for that matter in healthcare. It's very much dependent upon the individual dental practice and doctor and the services they're rendering and what they feel their value is and their worth is. To know exactly what it's going to be, you really need to decide who you have trust in and go to them and find out the exact fee. And so often there are so many other things that affect it. It's not, for example, with the immediate denture, just the cost of the immediate denture. That's usually absolutely a small part of the fee, because there's all of the preparation, the surgical procedures that are done that usually comprise the bulk of it. So it really does take a complete analysis and workup to determine what a particular person's individual needs are. Well, we offer, particularly in our practice, a wealth of different methods of paying for your dentistry. First, you can pay for it outright. You can have insurance that pays a portion of it and you pay the difference. And then there are all types of third-party financing avenues. And they differ very greatly by the individual needs of a patient. For example, some people can put some down. Well, that will affect their payments and which organization were best third-party financing, where they're best to go through in terms of what the interest rates were going to be and the length of payments, etc. So we have 2 staff members whose main focus is staying up on all of these different payment mechanisms so that when it's determined what the exact fee is for the patient is, we can help them come up with something that comfortably fits into their budget. Oh, absolutely. You will be able to eat. Now, on the first day, mind you, you've had a surgical procedure done, and you're now wearing a prosthesis, a beautiful looking prosthesis, but it will take a little bit of getting used to. Your tissues might be a little bit tender. So what we recommend is that at least for the first 24 hours, you concentrate your food on cold liquids. The cold is excellent for you, and the liquids, you're not having to put a lot of pressure on things in your mouth. So it could be carnation instant breakfast, milkshakes, this type of thing for the first 24 hours. After that, you can begin eating regular food as you can. Of course, you wouldn't want to start out with a heavy steak, a well-done steak. But what we recommend is that patients slowly work their way up according to their own level of adaptability to the more difficult foods that they eat, so that within, maybe a month, 2 months, they're eating whatever they want comfortably. It works different whether it's an immediate denture for your top teeth or your bottom teeth. On your top teeth, what we do is we achieve to cover what's called all the bound down tissue. In other words, there are really basically 2 types of tissue in the mouth. The kind like you have on your roof of your mouth that doesn't move, and then the soft floppy kind that you have on your cheeks and your lips and your tongue. So what we do when we make a set of dentures is try to cover all the hard bound down tissue, but none of the soft floppy tissue. And then with that, on the upper denture, because the upper jawbone is stuck to the skull, the cranium, it doesn't move, we're able to achieve suction, excellent suction in fact. You don't need to wear adhesives. On the lower denture, The lower denture, there is no suction. So we make it so it just floats in there. Now, by that, what it means is it's not going to move on its own. You would have to move it. You would have to take your tongue and lift it up or do some type of action that's going to move the denture, because it just sits there passively. It's not an active appliance. It's a passive appliance. Speech is absolutely excellent on most people, and if they do have a little trouble at the beginning, we just recommend that they go home and read out loud to themselves so their speech patterns can quickly return. When it comes to eating, there's a slightly different chewing pattern than there is with people with regular teeth that we show people how to do, so they're able to accommodate and eat all the foods that they used to eat. You can wear your dentures the vast majority of the time. I look at dentures as if they're a piece of jewelry that you have, or a watch, or your clothes or your shoes. Your tissues need to sometime be uncovered and exposed to the atmosphere and fresh air. It's not healthy to have them covered all the time. So we recommend for most people, and they're comfortable with this, is that they take their dentures out at night while they're sleeping. A lot of people, though, are sleeping with someone else, and for personal reasons, they would like to wear their dentures at night. So for those people, we recommend that they leave them out perhaps for an hour during the day, often while they're getting dressed or doing their bathroom functions in the morning. So basically, you never have to be without your dentures in a social situation or a situation where you want to use them eating a meal, etc. So you're keeping them in there pretty much all the time, but they should be out of your mouth at least a little bit every 24 hours. Well, a lot of people want to know how long they're going to have to be without teeth. And the answer is, you're never going to have to be without teeth. It sounds kind of funny until you think about this expression, but the worst someone is going to look is when they first come in to us within their natural condition, because on the day that we do the necessary procedures, and we will immediately, and that's why it's called an immediate, place their denture in. So they literally will wake up from their sedation, get up out of the dental chair, and walk out with their brand new smile. Well, a lot of facilities, the vast majority of dental offices in this country, send their dentures out to be made in commercial dental laboratories. We at the Smile Center have our own commercial dental laboratory in-house. So I'm in direct control of the fabrication of the dentures, so we can absolutely get beautiful customized dentures for every patient. Very often I'll actually even bring our main denture technician into the treatment room to meet the patient, see their personality and smiles, so that person can then fabricate the dentures along the lines of the personality of the person to help make it just super real. A lot of people want to know is this painful? Will it hurt them? And the answer is unequivocally no. We today are able to control pain extremely effectively. There is no reason why anybody should be hurting. In fact, if they come in with pain, we can very quickly get them out of pain. A lot of people would think that we're doing surgery, so they should have a lot of pain after the surgery. Actually, they don't. The way we achieve that is we will often supplement the medications we give them with steroids to hold down swelling, black and blue, and infection, antibiotics to hold down the infection also. Patients often come in the next day for their post-operative visit, and they just look beautiful. They have no swelling, no black and blue. Their speech is clear as can be, and they're incredibly happy. So the answer is no, there's no reason to be in pain. Now, by that, I'm not implying that this process is fun. This is not fun. It's a necessary thing that a lot of people go through because they hate their smiles so much, or their smiles are so destroyed, that this is a second chance to live a happy life. So they may have a little bit of discomfort, but nothing that any one of them would say they felt pain or was painful. A good candidate for an immediate denture is someone who really hates their teeth. Their teeth at this point bother them so much that it's psychologically affecting their sense of well-being. They really don't like their teeth, and they just want to be done with it all. They've been seeing multiple dentists who've been doing numerous procedures, and they've still ended up extremely unhappy with the way they look. And so here we can very, very quickly give them a beautiful smile, and they can just be done with all of that. So that is someone who would qualify for immediate dentures. We can also, for some people, add implants if we like, to support the dentures or to replace the dentures for those people who would like to go through that type of procedure also.